Madam Chair, we are now live.
Thank you, Julian. I call this meeting to order. This is the Public Safety Committee of the City Council. Today is March 9th, 2021. All committee members are present today via Zoom. This is a remote or online meeting where all participants will be on a video or audio conference. We are holding this meeting remotely to allow everyone to participate safely while we are conducting business under a public health emergency. We appreciate your patience as meetings are conducted this way. Members of the public, city staff, and media have the ability to view this meeting live through YouTube and Zoom webinar. The live stream can be accessed from most smartphones, tablets, or computers. For those watching on the live stream, thank you for joining us. One written comment was received for today's meeting. It was provided to members of the committee. Members of the public will be able to address the committee if they have signed up for public comment per the rules published on the agenda last week. Members of the public will be moved into the Zoom meeting room once we begin public comment. You will remain muted until you're called upon to speak, at which point they will have 2 minutes to provide comments to the committee. After that, we will again be muted and return to the Zoom webinar where you can continue to observe the meeting live. So we're going to start off with public comment. We have 3 individuals lined up to speak. Will the Zoom moderator, Mr. Moya, please move the members of the public who signed up to speak?
Madam Chair, 2 public speakers are here and in the meeting room. If you want to go ahead and give the ground rules real quick, and then I can call on them to speak.
All right, thank you. And hello to the individuals joining us to provide public comment. If you're watching through the YouTube live feed for this meeting, please mute it this time. We get some feedback as you play the YouTube and provide public comment. Here are the public comment ground rules. Comments are to be addressed to the committee members only. Please keep your comments germane to the topic of today's meeting. Any disruptive conduct or non-germane commentary will result in removal from the Zoom meeting room. I also ask that we remain respectful of one another. There will be a 2-minute time limit. The timer will start once you begin speaking. Then the Zoom moderator, Mr. Moya, will let you know when your time is up. Mr. Moya, will you please start with our first public commenter?
Thank you, Madam Chair. Our first speaker is Maxwell Kaufman. Please go ahead and unmute yourself, and your 2 minutes will begin when you start speaking.
Thank you, Madam Chair, members of the committee. Thank you so much for allowing me the privilege to speak today. My name is Max Kaufman. Many of you know me as a mental health attorney with the Public Defenders. I do a lot of work with on the board of MRAC, the Criminal Justice Coordinating Council. I also sit on the board of NAMI New Mexico. And I'm here today and speak in support of ACS. I've also been included, I have the honor of being included on the ACS Planning Committee, and have really seen the evolution of this department and seen it grow and respond to change. And I gotta say, it's transparency, openness to correction from the community, and the wisdom gleaned from outside jurisdictions who are doing work in this field are the fundamental qualities that will continue to make this department a success. On one hand, ACS, will need to continue its community engagement and address some tough criticism at times to make sure we get it right. But on the other end, we have to thank the administration for being bold and taking on this project and trying to actualize it, because without that, we wouldn't be having this discussion at all. This is a cost-saving, resource-saving, life-saving initiative, and it deserves support and assistance, and ongoing assistance. So I'm here today to really thank Mariela for engaging me, engaging the community, continually asking for feedback and incorporating that into this department to make it a success. So I see this department going in the right direction. And I have confidence that it'll continue going in that direction. And I want to make my support known to you all, that I'm very happy with Mariela and the way this is going, and I hope to see it continue that way. Thank you very much.
Thank you, Mr. Kaufman. Our next speaker is Christina Duran, please go ahead and unmute yourself, and your 2 minutes will begin when you start speaking.
Thank you. Good afternoon, everyone. Chair Sena and City Councilors, thank you for the opportunity to speak this afternoon. I want to concur with all of the comments from Mr. Kaufman. Well said and summarized. I feel the same. I've been involved in some of the planning efforts. I have worked closely with Mariela. Thank you, Mariela, for your inclusiveness and making sure that you do get the needed input to make this department a success. I want to mention, again, I'm the Dean of the Facundo Valdez School of Social Work, New Mexico Highlands University. We have campuses across the state, including one here in Albuquerque, an Indian school near San Mateo. We offer a BSW, the Bachelor of Social Work degree, and the MSW, Master of Social Work degree. Listen, social workers have been on the front lines of these kinds of efforts for decades. This is, we're really uniquely positioned to do this kind of work, to work across disciplines, across occupations and roles, to form the kinds of partnerships needed to be able to make this kind of department a success in order to really humanely and effectively serve the needs of our residents in crisis in particular. So crisis response work is the kind of work that social workers are really suited for because of their training, because of their knowledge base, skills, and so forth. So that's one thing I wanted to mention. And then the other thing I wanted to mention is, of course, related to a workforce pipeline. We offer, we're a professional school. Our students graduate with their degrees ready to join the workforce. We already engage with the State Department of Children, Youth, and Families. It's a stipend program. Students get some of their tuition paid. They get a stipend in exchange for committing to work for the department upon graduation. During their field practicum hours, our students do a lot of hundreds of hours in field practicum. They work in the position of someone who might do that work and then are prepared to move into those roles upon graduation. So those are the couple of the items that I wanted to share with you today. I'm really excited. We've been involved now for several months and have been observing. I just wish all the success in the world to the department and to all of you, to Mariela and others as we move forward. So thank you so much for your time.
Thank you, Mr. Ann. Madam Chair, we had one other gentleman sign up for a public comment, but I don't see his name or phone number in the attendees list. So that'll conclude public comment.
Thank you, and thank you especially to Dr. Duran for coming here and addressing this committee. As we had heard, public comment and input is so very valued. So thank you for coming for this committee. We're going to move on to agenda item A now, a presentation on the Albuquerque Community Safety Department update. With us, we have Mariela Ruiz Angel, who's the coordinator, to give the presentation. Thank you.
Thank you, Madam Chair and members of the committee. Actually, Julian, can I share my screen instead? Would that be okay? If not, it's totally fine.
Yes, give me 1 second.
Great, thank you. So thank you again for having me. I think many of you have now heard a most recent update about ACS, but I wanted to tie a couple things that together that I didn't think we really got a chance to talk about last week that came up. So again, this is around our new department, Albuquerque Community Safety Department. So many of you have seen this slide, right? It's a cabinet level department and it's response to 911 calls that do not require police and fire response, right? So this is for potential calls around inebriation, homelessness, addiction, mental health. And then in addition to immediate intervention, we'll do outreach and follow up with community as well. These are first responder types of individuals, right? This is not to take away services from our partners in the community, right? We have no intention on doing intensive case management or long-term intervention. This is really about being able to get to the scene and address the situation at hand to figure out how to get them to the right resources. So like Dr. Duran mentioned, this is really about potentially bringing in social workers or housing and homelessness specialists peer support workers as well. So I think we definitely have the pipeline, the workforce that I think is really wanting to do this kind of work and who already has been. So we're really excited about being able to put positions out there for them to be able to apply for. Some kind of high level goals that we again are not formalized, but have really been helpful as we continue through this process. So ultimately it's to send the right resource to 911 calls that do not require police or fire. This is not to take away calls. It's ultimately just to make sure that we can go out to calls and give the time back to police and fire to really concentrate on their expertise and the goals that they have for their department. We want to reduce that footprint, right, on policing in communities. We want to decriminalize that mental and behavioral health issues and illnesses. So there are tons of different 911 calls that come through that do not require police, and we can easily go out to be able to help pull them, right, put new types of folks in these places and pull police back to really concentrate on the types of calls that they need to, right? Violent and high types of crime. And then the last piece, which I think is going to be a huge piece that we can do, and we already do well as a city, but definitely need to build more capacity, and that's to improve access to services across the city, within the county, and then in our community. We have a ton of different service providers, and they all have different missions, and they all have different ways of providing services. And so I think in part of this is it's to help in that coordination, it's to help in connecting community to those services, and really to help bolster each other in the work that we're doing. So again, we talked about an intensive community engagement process that we had throughout the last 6 months, and it's still an ongoing process. It's something that we are very proud of, that we had an opportunity to really be innovative around how we did this community engagement, right? With COVID, normally we would have a nice big event and we'd be able to bring, lots of facilitators and offer, coffee and have ability to really be able to have a venue to share ideas. And instead we took this virtually. And so we had lots of different ways that we did engagement. And this slide, and if you haven't had a chance, please take a look at the full report. It kind of gives some more details to what we heard and themes that we took away. As Maxwell Kaufman mentioned, we have an ACS planning committee, and this came from Councilor Borrego, who really wanted to see something like this come to fruition, and we did too. So in the piece of legislation, it talks about having city employees and a county and a state, and we took it to a second level and included multiple community members that are experts or have experience working in this field from both lens, right? Not just from behavioral health and mental health, but also from a criminal justice perspective. So I'll kind of linger here for a little bit. This is again our org chart. And you can see here, I did add a little bit. I think there was some questions around like, how many people are you thinking about starting with? And so we did add here, you can see that in our deputy of field response, so this will be kind of one part of the department. We're starting off with 4 clinicians and bringing on a clinical manager to help with that supervision that's so necessary for our licensed clinicians, who they'll also be able to help in overseeing the behavioral health responders. These are folks that will go out in pairs of 2, and so on and so on. And so that's one kind of part of the department. And then you can see on the other side with the other deputy of policy and administration, they'll have oversight over our HR and fiscal and policy, and again, the pipeline programs that we've talked about so much. So we see that this is just for FY21. I think that we have a long list of hopes and dreams of what we'd like to see in this department as it grows. I did want to go a little bit more into a couple of the positions because and highlight a little bit of what they do. So I've talked a little bit about the mobile crisis team, and these are licensed clinicians. So they already have They have the highest level of licensure in order to be able to diagnose or to be able to write certificates for evaluation. So if somebody needs to go to the hospital to be evaluated. This is the partnership that was created in 2018. This is not new. At the time, we felt that it was a good fit to have contracted with HopeWorks. And then here now, a couple of years later, in talking to HopeWorks and in working more closely with the county, we felt that it was a good fit for us to bring into this new department. Everything about this, this team will stay the same, other than being supported by this new department. So we're very excited. These are a group of 4 individuals who have come on, and we've been working very closely with the county and the police department to just really provide them with a new sense of a home. And so we're excited about getting them started. These are folks, again, that go out in a co-response model. So they have a partner within the crisis intervention team that they go out with every single, right, during their shift. It's like a 10-hour day, and they're in the car with those police officers and those sheriffs all day long. So they are extremely valuable to the work that we're doing. And we'll continue to use them for those very high acuity types of calls. The second tier of that is that behavioral health responders that I've talked about, right? These are potentially a little bit, it can still be licensed individuals, but we really want to bring in people who have that background in working in community, working with folks who do have backgrounds in alcohol and drug abuse, homelessness, who may have had problems in the criminal justice arena, and who can connect with diversion programs, right? So that will be a much larger pool of individuals that we can hire from. And these are also folks that will go out in pairs of 2 without police at the, in the initial call. They will be, again, going out to a variety of types of calls. And again, these are calls that do not require police, fire, or EMT response. So initially, these are folks that will go out by themselves, and we'll see where it goes. Now, we can anticipate that at some point, if there's a situation that escalates or a situation that cannot be de-escalated, we may then need to bring in the appropriate response, right? It's all about the right response. But again, we will continue to collaborate with police, our hospitals, right? Well, that's a big partner of ours. And then all of our partner agencies that we've already been connecting with, but we'll need to have stronger relationships with as we go through this process. And then finally, right, outreach, intervention, and follow-up. And the last piece, which we really want to focus on as well, which I haven't done as much, but it's really about this other piece of safety that we want to be able to provide. And these are what we're calling our emergency community responders. These are folks that are going to have potentially backgrounds in safety, or right, potentially mental health, social work, community engagement. The scope will be a little bit broader, and they will be trained by Red Cross during a week's course that helps to provide them with skills around life-saving interventions. So it's not just physical life-saving, which is a big part of it, but it's also around understanding the mental health side of it. And so these are folks that will kind of be much more able to help folks, especially when if they're discombobulated or inebriated, those 2 a.m. calls that we tend to get. These are folks that will be able to go out to the scene and understand what the situation is at that moment. These are also folks that we will be able to train them on going out to, again, calls that don't necessarily need a police or a firefighter to go out to. So abandoned vehicles, we have lots of abandoned vehicles. And in a lot of cases, sometimes it's people who are living out of their cars. We have seen an uptick in that situation since COVID-19. And so that's a big one that we'd like to be able to send folks to be able to, say, hey, we understand that this is happening. How do we connect you? We also want to be able to help them send folks to non-injury accidents, right? So that we don't have to waste police resources going out to a scene that doesn't necessarily need a police officer. We see them all the time when we're driving. It's the person on the side who hasn't moved their car because they're waiting for a police report. And then similarly, they'll be doing community outreach, intervention, and follow-up. So this last slide is really, again, I think many of you have seen this. It's the last piece of this kind of first leg of work. We will continue in our outreach with community, with our steering committee. We will make sure that we have been coordinating educational campaign to make sure that community understands what this department is, what the expectations are, and then also continue with any intergovernmental and county planning that we need to do together so that we can be on the same page. During the administrative piece, we want to make sure that we're sticking to our policy and standard operation procedures. So that's happening. We also need to make sure that we are continuing to work on our budget to figure out how to be resourceful and still, right, make sure that we're on track. So we don't want to grow too fast, and we also don't want to grow too slowly. And then lastly, the operational piece, it's the last leg, right? It's developing, testing, it's hiring that staff, it's onboarding, it's training, and it's hopefully implementation piece of it so that we can really see how this is going to work. So I think this is where we're at, and it's taken as it feels like it's been a long time, but it's been a quick turnaround, and I think we're in a really great place. But we still have a ways to go as we work through all of this. So is there any, I want to open it up now for questions.
Thank you, Ms. Ruiz Angel. Councilors, any questions from the committee? I know we have another item later on the agenda, but if you can keep it to the presentation and then we'll move on. Councilor Benson?
Thank you, Madam Chair. Mariela, with the MCTs, is that going to continue to be, is HopeWorks going to continue to be involved in that, or are we just kind of moving that over wholesale?
Yeah, we're bringing it over. They felt that was a good fit. Also, it's very much the logistics seem to work better in-house. So it was a mutual agreement.
Okay, that sounds good. And I may have one other, let's see. Guess that's it for now. Thanks.
All right, Councilor Benson. Councilor Bassan?
Thank you, Madam Chair. Ms. Ruiz Angel, do you know about the implementation process, and like when do we take that leaping off point? How much? Because I know we asked you for planning. I know that we put this on you, so I'm not trying to get out of that part, but at what point, and when do we get there? Because I think that it's going to be key to know when you feel like all of the planning has happened. And then when do we move on from that to actually taking a jumping off into implementation? And then my second question is, can you elaborate and explain a little bit about how dispatch will be trained on being able to differentiate between the calls?
Sure. So I can ask the first one, and then I'm going to ask David Maurer to be able to help kind of give more clarity on that second piece. But implementation wise, we truly believe that once we get leadership hired, that job role for the new responders is pretty much in draft and ready to roll as soon as we are able to start that, right? We have the funding available for us. We think that it'll be a pretty fast and furious next 4 months. Our hope is to bring on folks. We already have a nice pipeline of individuals who have shown lots of interest for positions. So I don't think recruitment will be as difficult as I think what we anticipated. And so my hope is, and this is very much hope, our hope is that we can get people started by May or June at the latest, assuming that we can get people hired, onboarded, trained. So yeah, that's kind of our earliest. And the reality is, I think that even as we go through, we won't be taking on like the world. This will be very, very structured and somewhat, I hate to say the word pilot because it's already, we're going to jump in, but we want to tackle on certain types of calls. We want to tackle on certain parts of the city. and see where we go from there. And then as we grow, we can take on more and more. So it'll be a little bit of a controlled environment for that first piece. But our hope is that we can, similarly to Denver and other cities who are doing this work, that'll help kind of give us a pathway to where we think we need to grow and how fast we need to grow. And then that second question around dispatch, it has been an ongoing question around how we're gonna train. And I'd like for DC Mallory to give a little more information around just even their current training and how they, you know, one of the programs that has been very successful is the wellness check program. And that's a program that gets dispatched through fire. So if I'd like to refer that question, that'd be great.
Good afternoon, Madam Chair, councilors. Councilor Bassan, to discuss your question, most of the dispatchers are already trained. We're already accepting all of these 911 calls. So it's not necessarily a matter of what training we need. It's just how do we get the appropriate resources to respond and how do we dispatch them? Currently, we use MDTs, which are the field computers, which are quite pricey and expensive. We're moving to a new CAD system, which should integrate with cell phones, which should be a lot easier when we start adding all of these responders in. We can now dispatch to their cell phone without having to buy another bulky piece of equipment that costs quite a bit of money. What we did with the wellness checks, it's one of those ones that it went back and forth with police and fire. Cell phones are great, but also in the 911 world, people see things, they make multiple calls. It's now much easier to call in a car wreck or a fire. Now we get sometimes 5, 6, 7 calls for the same incident. So our dispatchers do a great job of managing that. With that, a lot of times we see people at the bus stops or elsewhere outside a grocery store. Someone feels the need to call. They don't really know what's going on with the individual. They don't feel safe approaching the individual, asking if they need help. So at that point, they call 911. Who should respond? We don't really know what's going on with them. So at that point, we looked at all of our data within fire when we were responding to these. A lot of times when we show up, you know, maybe 7 minutes later, that individual up and left because there was nothing wrong. Many times we show up and they don't have any needs. They don't have any requests. They don't want to go to the hospital, don't want any help. So majority of the time, we were just sending 4 people in a big fire truck to really a call that didn't need any assistance, whether it was police or fire. So talking with Metro Security, their individuals were already out patrolling. What we asked them to do was to make contact with these individuals. So what we did is we kept them on the bus stop routes and out in public. We don't send them in anywhere to where they're not seen. We want to keep them in contact with that individual where other individuals can see during passing by if they need help. So it's been very successful. We created units in our CAD system. We take the calls, we ask the questions, we filter it down. If there's no safety needs or we don't know that they have any medical needs, we will dispatch them. So we took some of our older computers, gave it to them, programmed their radios with our channel in there. And now once we get that call, we filter it down. Our CAD recommends that we dispatch that unit. Now they've been very successful in arriving to those calls, making sure they don't need any help. If they do, they call either fire out or police out. But the infrastructure is there for us to build ACS. The training is there. We'll have to tweak a few things, but once we figure out what resources are available, exactly what specific call types we will be sending them on, we can generate this and get it going relatively quickly.
Thank you, Chief. Thank you, Madam Chair.
Councilors, any other questions or comments? All right, seeing none. Thank you so much, Ms. Ruiz-Angel, for that presentation. I know that many of my constituents were very interested in hearing of an update and knowing what's progressing. I know even in the National League of Cities conference right now, having these discussions nationwide. So many of other cities are looking for other models and really paying attention to what we're doing. So I really appreciate this presentation and for also meeting with individual counselors to get that update and hearing our feedback beforehand. So appreciate that. But you're not free just yet, as I know we have another item on the agenda. So we're going to move on to EC 269 Albuquerque Community Safety Department Quarterly Report for new department FY21 R20-99 Objective 16. I move a receipt be noted. Councilor Davis seconding. Councilors, any questions? All right, I believe it's Ms. Montoya that will be doing the roll call vote.
Councillor Bassan,
Yes.
Councillor Benton,
Yes.
Councillor Davis,
Yes.
Councillor Jones, and Councillor Senna.
Yes.
And that passes on a 5-0 vote.
Thank you all. I so appreciate you all for joining, and also members of the public. There being no further business, the Public Safety Committee meeting is adjourned. Thank you.